I am really delighted and honored to introduce Dr. Nini Iyizoba. She is a medical doctor, certified project manager in global health, an advocate for women's health, writer, certified fertility health coach, and entrepreneur who is passionate about the well-being of all. She received her medical degree as a doctor of medicine from Avalon University School of Medicine, Ohio. She's currently a health and wellness contributor for the Guardian newspaper, where she writes health articles weekly, discussing relevant medical issues. Dr. Nini Iyizoba has received several recognitions and awards. She was named as one of the 100 most inspiring women in Nigeria by Leading Ladies Africa organization, an organization which recognizes change makers and female leaders who are breaking boundaries through the nation. She is the CEO of Fertile Life by Dr. Nini, Revive Integrative Health, and the creator and executive producer of a health and wellness television talk show. Ladies and gentlemen, with a drum roll, I'm so excited and delighted to invite Dr. Nini Iyizoba.
Hello, everyone. Happy to be here. Nice to meet you all. It's a pleasure having you all on board. Thank you for having me.
You're welcome, ma'am.
You're welcome, Dr. Nini.
Thank you. Pleasure. So we should just go right into it, or should I wait a little more?
Dr. Nini, you can go right into it.
Okay. Okay, so hello, everyone. Today we're going to, my name is Dr. Nini Iyizoba, like she said. Today we're going to be discussing male, how do I remove this from my screen? Sorry. So today we're going to be discussing basically infertility, male and female infertility, talk about the causes and management of infertility in a nutshell. Next slide, please. Okay, so preparing for pregnancy can be a very exciting time for a lot of people, but for some people, it's just, for some people that experience issues trying to conceive, it can be a period of undue stress. It's important for you to let your patients know that, you know, everybody's case is different and what works for this person may not work for this person. So if you have a person that got married or, you know, was trying to conceive and had, you know, successfully got pregnant in 3 months and that is not the case for you, you know, everybody's case is different, basically. You have patients that come in and tell you, oh, I had a friend that had fibroid and she was taking this and, you know, please, can you prescribe this for me? That doesn't mean that, you know, that's going to work for you. So it's always important to let the person know that each case is different. Some people get pregnant quickly and some don't get pregnant as easily as others. Next slide, please. Okay, so first of all, we have to understand the problem. What is infertility to start with? Infertility is described as unsuccessful conception after after having unprotected sex for over a year and not successfully getting pregnant or not being able to conceive. That is the diagnosis of infertility. So if you have a patient that has been diagnosed with infertility, it's important to first of all let them know that it is a very common issue. It is, you know, in the society that we are in, a lot of people are stigmatized when they are diagnosed with infertility. You have to educate people about how common it is. It is a global health issue. A lot of people suffer from infertility. Millions of people actually across the globe do suffer from infertility. So first of all, let them know that you're not alone. It's a common issue. 1 in 6 couples have difficulty conceiving, and with appropriate treatment, actually, you can increase your chances of successfully getting pregnant. So first of all, let them know that you're not alone, to first of all break that stigma that is associated with the diagnosis of infertility. Also to let people know that, once again, about the stigma, that infertility is not just a female-related issue. Research has shown that causes of infertility, 33% of causes are female-related, while another 33% of infertility cases are male-factor infertility, and another 33% are unexplained. So gone are those days when people just point to the woman when they hear, oh, this couple haven't had their baby yet, or are finding it difficult to have a kid. Gone are those days. So women, you should also, let your partner know that it takes two to tango, basically. And doctors should emphasize when only the female partner comes in for treatment, to also encourage them to bring in their spouses as well, or their partners, because like I said, it takes two to tango. And causes of infertility, they are equal across the board. It's not just a woman problem. It also there's also male factor infertility, and we need to start getting used to the idea that that is a problem as well. So both parties have to be equally treated, diagnosed, observed for optimal results. Next slide, please. Okay, like I said, so basically when it comes to the management of infertility, like I said before, 33% female, 33% male. So when you visit a doctor, obviously, when your patients come to visit you, you have to, take a thorough history. And when I say 33% of female related, so some of those may be chemical imbalances. Some can be structural imbalances for the female, like PCOS or endometriosis or ovarian failure. So all those are established causes within that 33%. While for men, it could be stuff like sexual dysfunction, even congenital anomalies or low sperm count. So these are all part of the 33%, which when you are with your patient, you're able to go through their history, do the screening, do various tests to arrive at what the main problem may be. And if, everything checks out, we also have to not ignore that extra 33% that is unexplained. And you find out that most of the people that have this undue stress when it comes to infertility are those people that have unexplained infertility. Because, when you know the problem, it's easier to address it when you know the cause of the problem. Oh, it's fibroids. Oh, okay, so are we going to take it out? Are we going to give medications to reduce it? Are we going to give hormonal treatments? If it's endometriosis, are we going to go in and do surgery? If it's sperm count, so there's treatments for those things. But what about those 33% that is unexplained, which is really what I want to focus on now? Because, like I said, when your patient comes to see you, you have your evidence-based, guidelines of how to treat, established causes of infertility. What about those ones that are unexplained? So this is I think those 33% are not very well tackled. And most times, lifestyle factors are one of the major contributing factors that contribute to this unexplained infertility, which a lot of people suffer about because you don't know what's going on. And I think people take that for granted. There's so many habits that people indulge in daily and, or just lifestyle modifications, lifestyle factors and habits that contribute to making it more difficult to conceive. And that's really what I wanted to focus on, because that 33% seems to be more ignored. And that's what gives more patients that undue stress, because you don't know why it's happening. It's easier when it's explained, but when you don't know what the problem is, it's actually very stressful for most couples. So we're going to really talk about that today. Next slide, please. So what are these factors Some of them age. I'm just going to run through them: age, egg quality, egg health, weight, stress, environmental toxins, smoking. Next slide, please. Okay, I'm sure there's some others, but okay, so let's dive into it. So age is one of those, one of the major factors that, people tend to overlook when they're trying to get pregnant. And maybe for lack of not trying to come off as rude, most people or most physicians don't like to discuss it, but age is a major factor when it comes to trying to conceive. The older you are, it's the more difficult it is to get pregnant. That's just the basic truth. And it's important to let your patients know about the statistics. Basically, medically speaking, as you get older, there's a natural decline in your ability to conceive. A woman's fertility peaks around age 25. And at that age, your chance of natural conception is about 20% every single month. But from 25, the percentage of, getting pregnant, drops up until you're 30. And then by then, by 30, it takes a nose downward dive. And by 40, your chance of natural conception is about just 10%. So that is something that people should keep in mind, because if you see, as a nation, as a generation, we're waiting longer and longer to have kids. And I'm not saying there's anything wrong with that. Most people are more concerned about their career these days. If you look around you, what used to happen with our mothers is not what's happening with us now. For example, my mom had, at age 34, she had all her kids, and she had 8 children. So if you look at a lot of 34-year-olds these days, most people have not even started on that journey. And I'm not saying there's anything wrong with that, but it's always very important to educate your patients. If, having a child is something that is very important to you, it's important to let them know that, look, as you get older, it's going to get more difficult. So discuss options with them. Do you want to freeze eggs, stuff like that, or just to educate them? Because most times people take a lot of things for granted, and age is one of them. So it's just explain to them that it's going to get harder, and that's just the main truth. Believe it or not, or like it or not, that's just the main truth. So educate them and, offer different options that are available for them in case they want to get pregnant, or have a biological child down in the future. You could introduce them to egg freezing, or you could just, even talk to them about it, and that might help them in their decision making. Next slide, please. Okay, just in line with egg health and age is the egg quality. So the egg quality is like the true driver of fertility. The egg driver is like a true driver of fertility. It's very important for everything. Your egg health or the quality of your eggs determines if you're going to successfully, be fertilized, or there's going to be successful implantation or the growth of the embryo. That all depends on the egg health. So this is a big concern for women, especially as you get older, like I said, because as you get older, the quality of your eggs are going to drop, which is why I said to also discuss with your patients if that is something that they want to do. If you're trying to get pregnant, please focus on having dedicated egg health program. There are different programs, herbs, medications, food and stuff like that, that would help in improving your egg quality. So weight is another one of them. Weight is another thing that we take for granted. And this goes with obesity and anorexia, even though most of the problems are, people just think it's just when you're overweight, but goes both ways. Maintaining a healthy weight is associated with having more success when you're trying to conceive. So having a healthy BMI, would make it easier. So if you're overweight or if you're severely underweight, it's important to actually have that checked out or start, having a guideline or trying to lose weight, even losing like 10% of your weight if you're obese or overweight, losing at least even 10% of your body weight would successfully increase your chances of getting pregnant if that is an issue, because the weight just messes with a lot of other issues or hormonal imbalances in the body. So it's important to let your patients know if they're obese, to have a healthy exercise program. And I'm not saying go and kill yourself in the gym or go and start running a marathon. No, just, even walking, cycling, just little stuff, 30 minutes of exercise most days. Don't overdo it, because now that will also affect your chances. So just light stuff. Next slide, please. Okay, so stress, having a diagnosis of infertility itself is actually a stressor, and stress, living in a country like ours, like Nigeria, it's hard to avoid stress, but it's important to also know how to, deal with stress. So we're all going to have stresses at some point in our life, but it's important to realize or educate people that stress hormones such as adrenaline, cortisol, catecholamines, they inhibit the release of gonadotropin releasing hormone, which results in suppressed ovulation in women. This is research that has shown this results in reduced sperm count in men. It lowers the libido in both men and women. And these hormones, signal the body that so when you have elevated cortisol levels in the body, it's going to signal the body and let them know that, okay, no, we have elevated cortisol. This is not the right time for you to be conceiving. So you have to explain to the patients about how to best manage your stress or adopt, a routine that would help you to minimize stressors. I know having to go through, fertility treatments or having the diagnosis of infertility, like I said, is actually a big stressor for a lot of people. And most people don't know how to handle that. So you have to do what works for you. Is it maybe self-care, practice yoga, like positive, having journaling, positive journaling. There's different stress reducing routines that would reduce the effects of stress. And it's something to not overlook, because you cannot successfully conceive in a stressful environment. Okay, like I said, getting enough sleep, enjoyable exercise routine. So if the exercise is giving you stress, then it's not enjoyable. Practicing yoga, meditation, just some people can just, put on some Christian music if you're Christian and just play. That's also good meditation. Journaling regularly. Like I said, just pick what works for you basically and start on your stress reducing routine, because chronic stress disrupts your hormonal balance. And if your hormones are not balanced, it's going to make it difficult to successfully conceive. Can I go to the next slide, please? Okay, environmental toxins. This is a big one because it's actually become a global health problem, environmental toxins, because a lot of products that we use on a daily basis do expose us to these environmental toxins. And these environmental toxins have been proven to negatively impact health, and not just fertility, health around, all parts of all our systems in the body. So it's important to educate your patients about the different toxins that we can use daily, and to help them to know what it is, what it does to your system, and why it's important to take it out of your system, or reduce it, or remove it, or eliminate it from your daily use, basically. Can go from like your perfumes to body lotions, washing detergents, deodorants. There's so many, we're exposed to them daily. Like when you read the research that surrounds it, it's actually mind-blowing, because it's like, how do you get away from it? How do you get away from not drinking water from a water bottle? My video, I'm sure, how do you get away from not using water from a water bottle? Because I'm drinking water from a plastic bottle, but that's actually one of the things that they tell you that it's unhealthy. So it's actually very important to let people know about these toxins and how they can affect your fertility. Can we go to the next slide? I think I have them. Okay, so yeah, avoiding some fragrances, BPA-free products, choose BPA-free products. So BPA, what is BPA? Is bisphenol A, and it's a chemical that is used in plastic production, and it's been used since like the 50s in plastic making, and now it's become like widespread, like a global health issue, because more people are realizing that these chemicals actually interfere with how the body works. They're endocrine disruptors, so they go into your system and they mess up reproductive system and most of your other systems in the body, and this can result in like miscarriages, low sperm count, you name it. These toxins are responsible for it, and they actually the percentage is high. So I'm not talking very little, I'm talking about high percentages. So like most of your body care products, and how they work is that they mimic your estrogen in your body and then they disrupt it. And a lot of the issues we have, like endometriosis, PCOS, these are caused by overabundance of estrogen in the body. So imagine having or using products that introduce more of those toxins in your body. Obviously, it's going to, like I said, like in my slide says, excess estrogen is linked to early onset of puberty, menstruation at a young age, endometriosis, uterine fibroids, ovarian cysts, PCOS, breast cancer, endometrial hyperplasia, and low progesterone levels. So these are all because of hyperestrogenism, so excessive estrogen. And these chemicals, not just the BPA, but all these chemicals and toxins, they mimic the estrogen and further make it difficult, because we're really messing with our hormones, and further make it difficult to successfully conceive. For men, excess estrogen has been linked to hormonal imbalance with testosterone, causes low sperm count and overall poor sperm health. So you have to educate your patients about, okay, what to do when you're buying, read your labels basically. Don't just go to the supermarket and just pick up anything. Now, especially when you're trying to conceive, especially when there's an issue, you need to be more conscious of, what you're doing, because there's a goal, and the goal is to get pregnant successfully and conceive and, have a child. So you need to be more intentional. Most things that people will take for granted, you, on the other hand, cannot do that, because there's something you're trying to work at, which is trying to, get pregnant. So read your labels, avoid drinking bottled water from plastics. This plastic has BPA in it. And if you don't know how these things are stored, like the warehouses, when it heats up or when it's exposed to heat, so these chemicals melt. That's why they tell you not to use microwave, because when, you heat up these plastics, the chemicals used to make them go right into the liquid or the food, and you ingest it directly into your body system. And obviously, over time, doing that is going to mess with your system. Like I said, it's going to cause hormonal imbalances. They have endocrine disrupting properties, and they mess with the endocrine system and how your body works. So talk to your patients to avoid heating food in plastic containers, in the microwave, to use glass instead. It's some places, even when you go out, some places you see that they've started selling water in like glass bottles. So if you see that, it's better to opt for that. Look for BPA-free products when you're buying. Read your labels. I also said in my slide that limiting toxins completely is not realistic. But when you have an idea of what it does to you and how it affects your reproductive system, it's important to now be more conscious of it, basically, and work towards choosing healthier options, or healthier options available. So these are just some more of the endocrine disruptors and chemicals that we see that are really bad for us. 4-MBC has been seen in sunscreen lotions, and it affects your sperm health. Also, triclosan is an antibacterial agent that we find in our antibacterial soaps. All those people that I'm not going to mention any brands, but yeah, you think antibacterial soap is the best one to use. They do have endocrine disrupting chemicals that have been linked to decrease sperm count, and affect even female reproductive systems as well. Next slide, please. Okay, smoking. Obviously, smoking is very detrimental to your health. Everybody knows that, but studies about cigarette smoking, not even just cigarette smoking, even cannabis use, studies have shown that smoking would make it more difficult to have a baby. And even if you do have a baby, or even if you do successfully get pregnant, smoking has been linked to increased risk of miscarriage, premature birth, or even low birth rates. So it's advisable to quit smoking altogether. And even if, as your lady, you're not smoking and your partner is smoking, it's also advisable to encourage the partner, because like I said, it's a two-way thing, to stop smoking, because secondhand smoking, it's going to also affect fertility and lower sperm count. So yes, not just cigarette smoking, but also cannabis use chronic cannabis use has been linked to low sperm quality. So other lifestyle modifications, like I said, your regular doctor visits. Most people also wait till there's a problem before they go see the doctor. This should be advised against, because it's better to start early for regular screening, have your regular screening test. And when your patients do come to you, it's very, very important to take a very good history, detailed history, especially if it's the first time. Take a detailed history so that you make sure you don't miss out anything, even stuff like, untreated STD, or how many partners you had in the past. Have you ever treated any STDs, sexually transmitted infections, because previous infections like STIs, both treated and untreated, increase your chances of infertility, and especially if it's untreated, like in women having PID, that's pelvic inflammatory disease, having PID and stuff like that. So it's very important to not just come to the doctor when you want to have a baby or when there's a problem. It's best to go regularly and have your regular screening test. And when they do come, to take a good history so that you don't miss out anything that, yeah. And then also in your doctor visits, it's also going to establish if it's a chemical problem, if it's a structural problem that is causing the infertility. And then if it's none of those, like when I'm saying like male factors or female factor, if there's none of that, then we can go into the unexplained and what could be happening there. DNA fragmentation testing, that's just a step further that conventional treatments don't usually, like when people come to the doctor. DNA fragmentation testing is another health test that conventional sperm checks won't pick up. So your regular sperm analysis, like I think it's on the next slide, your regular sperm analysis, like your sperm count, your sperm motility, would not show you the genetic content of the DNA. So DNA fragmentation is advised for people that, when it seems like everything is normal, so what could be a problem? It's advised to go a step further to actually suggest a DNA fragmentation testing for men, because this detects the level of damaged DNA in the sperm. Now, all men are going to have some level of damaged DNA, obviously, because you're living life. So obviously some level will be damaged, but a high level of DNA damage in sperm represents a cause of male infertility that conventional examinations cannot detect. Especially if you're trying to do IVF and IUI. It's so expensive, it's best to even just make sure that before you start, you have healthy sperm that you can work with. So this DNA fragmentation is usually as a result of oxidative stress, and it leads to poor embryo development, decreased implantation rates, higher risk of miscarriage, and ultimately infertility. Like even if you're trying to do IVF and IUI, it won't work, it won't take at the long run because of like this excessive DNA fragmentation. Next slide, please. So what are the causes of DNA fragmentation? Some causes include recent or previous infection, like I said, elevated testicular temperature. Some men just love to, after exercising, it's a cool thing. You go to the sauna and you stay there for 20 minutes, Yes, no, that's very wrong, especially if you're trying to conceive. So, because it damages your DNA, the sperm DNA, as you get older to advanced age. So it's not just women that, that biological clock should be affecting, also men, as you get older, your DNA is going to be more fragmented. So it's not just a woman thing now. So guys should also know that obesity, having a poor diet, drug use, illegal drug use, whatever, cocaine, whatever, is going to also affect your sperm DNA, cigarette smoking, exposure to environmental and occupational pollutants. Next slide, please. Okay, fix your gut. So this is another overlooked system. Like most people just think your digestive system is, and most people just think that the digestive is just to digest food, to eat, digest food and excrete. No, the digestive system is one of those systems that actually control a lot of things in the body. So when it's not working properly, it's going to affect other systems, and that includes our fertility. In fact, gut health is so important, and more research has been gone into gut health. Can you go back to the gut health slide? More research has gone into having gut health because your gut microbiome is very important, especially in estrogen metabolism. So good gut health or good digestive health helps to your estrogen, makes your estrogen active. And a lot of research, there's a recent research I was just reading, and it said higher link of miscarriage is linked to gut problems, like having a leaky gut syndrome. So more people are looking at, trying to fix your gut. So just, it's as simple as asking your patients, how often do you stool on a daily basis? Do you have issues with constipation, stuff like that? A good sign of a strong digestive or a healthy digestive system is being able to defecate at least once or twice every day. And when your patient tells you, oh, they have issues of constipation, GERD, all those things, it's something to look into about fixing your gut health. Like I said, research has shown that there is actually a gut health and fertility link, and more people are now looking at gut health, digestive health, and a way to avert that is to eat a natural diet, increase your fiber, all those things to fix it. Probiotics. So like I said, that's something that people are now looking at more when it comes to infertility, your digestive health, because it could be a contributing factor to delayed fertility. What's the next slide, please? Increasing physical exercise. That's just, like I said before, having a healthy exercise routine, like walking or cycling, just to increase your blood flow, because you need that, that blood is what gets your oxygen or oxygenates your organs, because you need your ovaries oxygenated, you need your uterus to be well, oxygenated for it to work properly. So having, that good blood circulation, which you get by regular exercise, is also essential in delivering your nutrients throughout your body, and also helps to improve fertility. You can't be sitting at home all day and just, you have to get. Next slide. So there, somebody's, can we mute Ibrahim? Distracted. Okay, there's several supplements that could help. Like I said, when there is a known problem, obviously there's hormonal drugs, there's fertility drugs, there is surgery, there's advanced fertility treatments like IVF and IUI. But when it's unexplained, it's important to introduce or advise your patients on different supplements that you can take to, promote a healthy reproductive system. Stuff like CoQ10. CoQ10 has been shown to boost antioxidant power and mitochondrial function to improve the quality of eggs. Like I said before, the eggs are like the true driver of fertility. So CoQ10 has been, proven to help improve the quality of eggs, and you can advise your patients to, take that. And I'm not just saying take it for 1 week or 2 weeks and then you get pregnant. No, it has to be part of a routine. Start earlier on, 3 to 6 months before you even, actively try to, do anything. So it should be part of a routine, not just, you're not taking like you're taking antibiotics. It has to be a routine, consistent use, and give it time. It's not going to work overnight. So CoQ10 is great. Melatonin is a good sleep aid, but it has been shown to boost antioxidants and encourages healthy ovarian function. There was one more back there. I think it was Zinc. Can you go back 1 second? Oh, fish oil. Fish oil is good omega fatty acids, especially for people that have advanced maternal age. So it helps in producing higher quality eggs as well for the women. Next slide, please. So for men, the DAA, D-aspartic acid, is a type of amino acid that is found in testicles as well as in your semen. So research has shown that these supplements that have DAA may increase your levels of testosterone, and testosterone obviously is the male sex hormone, and it plays an essential role in your male fertility. Vitamin C is great. It helps to, avert oxidative stress that leads to infertility in a lot of men. So taking 1,000 milligrams twice a day has been shown to improve semen quality. Vitamin D is another nutrient that may boost testosterone levels. And there's a research that I read one time that, reduced vitamin D was actually linked to infertility. So it goes to show that vitamin D is another nutrient, and high levels of vitamin D are actually linked to greater sperm motility to swim to the egg. Next slide, please. Oh, adequate zinc. Zinc is great. These supplements actually remind me of like the COVID time. Zinc, vitamin D, vitamin C, because it just helps your system. So adequate zinc is very, very important. It's one of the cornerstones of male fertility. Low zinc levels and deficiency is associated with low testosterone levels, poor sperm quality, and an increased risk of male infertility. Okay, Travelers terrestris is an herb, so it's very tricky trying to prescribe herbs to somebody else, to a patient, is because you don't know what they're taking. I would say be careful when trying to prescribe herbs, or also find out what other things they're taking so that you don't have any contraindications when you're prescribing herbs and all those things to promote fertility. Next slide, please. Antioxidants, like I said. So free radicals are one of the things that damage your reproductive system. These free radicals, toxins, stress, pesticides, illness, that. Talking about pesticides, I remember there was a patient talking for men now, and he was having such a hard time, or he was having a problem. On taking the history, the patient said that he had been using body spray on his penile region for as long as he can remember. He started that habit since secondary school. And I remember just thinking, this is just like spraying a pesticide on your reproductive parts for like the longest, like that's like directly introducing the toxins. So like I said, it's always very important to take a history, because the person could be doing something that they think is absolutely normal and maybe directly damaging the reproductive system. So antioxidants help and protect cells from free radical damage. Just take a good multivitamin that includes zinc, calcium, selenium, your vitamin E, A, C, and D. Like I said before, even folic acid, iron, they're all vital to fertility health. And deficiency in any of these nutrients can negatively impact fertility. So it's important to also let the patients know about this. Like I said, these things that we take for granted, if you are trying to conceive, there's some things that you just can't take for granted, and you should pay more attention to it. Next slide, please. Oh, is that all? That went by quick. Okay, so basically I've just run through lifestyle factors that that have been proven. So I'm not just saying it, they have been proven. Research has shown that all these lifestyle factors have been proven to affect our reproductive systems in one way or the other, whether male fertility or female fertility. And it's very important to educate your patients about these, because most times, most physicians just look for what the structural problem is. And if there's no known structural problem, just tell you, okay, nothing is wrong, just keep trying. No, you can't dismiss a person like that. You have to actually, educate them on all these other factors that have been shown to affect fertility. And I strongly believe it's within those 33% of unexplained infertility.
And Dr. Nini Iyizoba, I'm delighted. I'm sure everyone on this call have learned one or two things. Thank you so much. Thank you for hitting big on lifestyle modification, because at mDoc, we are big on it, making lifestyle adjustments in preventing chronic disease and other forms, and also making people live healthy and more productive lives. Thank you so much, Dr. Nini Iyizoba, for taking our time to talk about the causes of infertility in male and female. And since you heard it's more of a lifestyle modification, sign up on our Complete Health platform, and also nudge your members and your patients to do. You can sign in through the link. The link will be dropped in the chat box shortly, or you can use our USSD code, that is *347 *339#. Thank you very much.